measurement and analyses. Let's move to setting up a new patient. To enter a new patient, tap on the Add button. On the right side of the screen, you will now see the respective fields to enter the data. Enter the correct patient data, including last name, first name, gender, and date of birth. Please note, if the IWOL Master is connected to an EMR or a Zeiss forum, these fields will be pre-populated. In the fields below, you can enter the patient's pre-cataract refraction, which will be used in the Holiday 2 formula. However, entry of this data is optional. Following this, please select the correct lens state and vitreous state for your patient by tapping on the correct status in the drop-down boxes. The correct selection is mandatory for exact axial length measurement. When vitreous body state is set to silicon oil, the IWOL Master will calculate the target refraction based on the assumption that the silicon oil will be removed. Following this, visual acuity is optional. And lastly, please select the correct laser vision correction, in which we abbreviate as LVC in the interface. The correct LVC status allows you to automatically obtain the correct formula proposal in the IWOL calculation. This status can be changed post-acquisition. Before taking a measurement, here are some points to consider. Encourage blinking for optimal tear film and wide open eyes. Treat dry eye if possible. Ensure eye drops are used well in advance and avoid using eye drops directly before measurement, as this may affect the measured parameters, such as keratometry. Avoid performing applanation tonometry. Glasses should not be worn during measurement. Hard and soft contact lenses should not be worn during measurement, and a resting period is recommended. Okay, now tap on the Measure button to proceed. Firstly, set up your patient. Ask your patient to rest their chin on the chin rest and their forehead pressed firmly against the forehead rest. You can use the height adjustment buttons to align your patient to the canthus marks, which are used to indicate the optimal patient eye level for measurement. You can also tap on the arrow buttons on the screen. This icon will appear if the patient's forehead is not rested on the headrest correctly. Now your patient is ready for measurement. Ensure your patient is looking at the red fixation light and encourage blinking prior to measurement for a continuous tear film. Move the instruments to center the green crosshairs on the pupil center and ensure that the dots are in focus. You can use the traffic lights to find the optimal measurement position. Green indicates that the measurement is correctly aligned and measurement can be triggered. In auto mode, measurements will start automatically. In manual mode, start measurement by pressing the joystick button. Now move the yellow dots into the green box for correct alignment. Measurement will be triggered depending on your mode. Maintain alignment until measurement has completed. Once measurement for coarse alignment is done, apply the same for fine alignment. Once measurement is complete for fine alignment, repeat the same for fine alignment for fixation check scan. Now tap on Quality Check to proceed. The Quality Check screen allows you to quickly evaluate the quality of your measurement. When measuring both eyes, it is not recommended to perform quality check until both eyes have been measured. You will see signal quality indicators for the various images and measurements. Green ticks signal quality is good. Messages will appear here in cases of certain unusual measurements, such as in long eyes or in ambient lighting conditions. On the B scan, the green measurement gates for the cornea, the lens, and the fovea must be visible and the correct positioning must be checked. The signal quality indicators here are for central corneal thickness, anterior chamber depth, lens thickness, and axial length. For keratometry, check whether all 18 points are visible and in focus. The top tick is for standard keratometry and the bottom tick for total keratometry. In the white-to-white image, check that the measuring marks are positioned at the edges of the pupil to the iris and the iris to the sclera. And finally, the fixation check. A visible depression in the center of the fovea and/or by visibility of a dark, non-refractive layer underneath the fovea indicate correct fixation. Here is an example of good and bad fixation. If you need to remeasure due to quality of measurement or due to bad fixation, ensure the eye that needs to be remeasured is confirmed by the circle at the top right hand of the screen. Tap on Measure again, otherwise tap on Analyze to save the patient's measurements and to proceed to the Analyze screen. In the Analyze screen, B scans, more images and measurement values are displayed. It is important to check whether the measurement values are plausible and consistent for both eyes. The measurement values are shown with standard deviation for each measurement value. Scroll down to see the complete measurement values. Tap on the composite or single buttons to define the displayed measurement values. The user